Got Mr. Teddy Bear here. We're going to do a full head to toe assessment. We'll start with the head. Look at the scalp, the hair, the quantity. Move down to his face. Check his pupils are equal, rounded, and reactive. Have him follow my finger. Check his cranial nerves. Ask if he's alert, oriented. Does he know the date, the time, the president? Take a look at his skin for any lumps, bumps, acne. Have him open his mouth, looking with a pen light in with his mouth. Look at his tonsils, make sure they're not red and swollen. Make sure he doesn't have any fatigue eyes, his teeth are intact. No difficulty swallowing. Look at his ears externally, and then look in there at his tympanic membrane to make sure it's pearly. He's not having any problems hearing. Nasally, make sure he's not having any discharge with his nose. He's not having any problems with taste or smell. And then, as I'm doing this, I just look down over the skin overall for any lumps, bumps, rashes, odd-looking moles, anything like that. We listen to his heart, listen to his lung sounds, have him take deep breaths, listen anterior and posteriorly. Check out his abdomen, make sure it's soft, non-tender. Listen for bowel sounds. Palpate the bladder, make sure he's not having any pain. Try to palpate and capture a kidney, spleen, liver. Make sure you ask him if he's having any problems with urination, any problems with his bowel or bladder. Extremities, have him hold his arms out. Make sure he doesn't have any tremors, slight tremors. And he has full range of motion of all of his joints. Not having any numbness, tingling. Do some strength tests. Make sure he doesn't have any muscle wasting or anything like that. As far as musculoskeletal goes, make sure he doesn't have any crepitus or arthritis or pain anywhere, any of the systems. Female, we'd ask about last period, if they're on birth control, if they follow up with a gyno regularly, if they're at the age to have a mammo, any history of breast cancer, cervical or ovarian cancer. And I think that's about it.